Time for Women's Health Wednesday now. March is National Kidney Month, designed to raise awareness about kidney disease. And women are more likely to develop kidney disease than men. But there are some proactive steps you can take to try to prevent it. And joining us now is nephrologist Dr. Kelly Beers with Albany Medical Center. Dr. Beers, thank you so much for coming in this morning.
Thank you so much for having me.
And we were talking off camera about how so often kidney disease is asymptomatic. So we'll talk a little bit more about that. But first, just explain for us what happens when there's kidney damage and why it is such a concern.
So kidney disease is actually very common. 37 million Americans have kidney disease, which is about 1 in 7. But unfortunately, up to 90% of people with kidney disease don't even know they have kidney disease because in most stages it's asymptomatic. So what happens is there's damage to the kidneys, usually in the filtering mechanism. Our kidneys filter our blood, remove toxins, remove water, waste. And if that filtering mechanism becomes damaged, then the kidneys can't clean the blood the way they're supposed to. The way we are able to diagnose kidney disease is through testing the blood and seeing higher levels of toxins than we should have, and also testing the urine. You can get a simple urine test and you can see either blood or protein in the urine, which tells us there's damage to the filter, that the kidneys aren't doing what they're supposed to be doing. And there's a lot of risk factors that put people at risk of developing kidney disease. The most common being diabetes, high blood pressure, obesity, smoking.
And for women, there's preeclampsia in pregnancy, which is high blood pressure, right? But what else is another reason why women seem to be more prone to developing it?
So we don't really know why women are more likely to have kidney disease, but there's a few different theories. Anyone who has damage to the kidneys from something is more likely to develop chronic kidney disease. So women can develop preeclampsia, as you mentioned, which is high blood pressure in pregnancy, along with other signs of end organ damage, we call it, including protein in the urine. So that's something that we see, and women with preeclampsia are at risk of developing chronic kidney disease throughout their lives. Women also, because anatomically we're more likely to get urinary tract infections, having recurrent urinary tract infections can also predispose to potentially developing chronic kidney disease.
Interesting.
There's also potentially some hormonal reasons that women could get more kidney disease. We don't really understand that, but that's sort of the assumption.
Real quick, before we get to what we can do to be proactive here, you talked about those screenings. So do you, when you go in for your normal checkup with your doctor, is that just part of the normal exam when they take a urine sample here, or do you need to be more vocal and say, hey, how do we check for this? Or,
Great question, yeah. So if you're getting regular annual blood work from your primary physician, they should be including just a basic metabolic panel, and that includes testing for kidney disease.
I see.
So the creatinine and the eGFR are the things on your labs that will tell you if there's something abnormal with your kidneys, and then a basic urine test, urinalysis is also going to help.
So important to go for those yearly physicals.
Absolutely.
And get those exams.
Yes.
Okay, real quick, being proactive here, there are some lifestyle things we can do, hopefully, to lessen our chances. Can you speak to us about that?
So most important thing, don't get diabetes, or if you have diabetes, keep it well controlled. Keep your A1C as low as possible. Well-controlled diabetes, less likely to develop the kidney damage from diabetes. Keeping your blood pressure normal, following a low-salt diet, staying physically active. Obesity is also a risk factor for chronic kidney disease, so maintaining a normal weight with cardiovascular exercise. Heart disease is a risk factor for kidney disease. And also common over-the-counter pain medicines, NSAIDs, like ibuprofen and naproxen, all of those can damage the kidneys. So you want to avoid taking too many of those if you can.
I've heard that many times. People like, go for that Aleve, but you really want to make sure you need it.
Yes.
Don't overuse.
Absolutely. And if you're taking something like that, stay very hydrated.
Okay. And there are treatments here, obviously. At the earlier stages, it's really to slow the progression, you were saying? Yeah,
absolutely. So we do have medications that we know will slow progression of kidney disease, especially in people who have diabetes, but really anyone with kidney disease. There's different classes of medications that we put people on that we know will slow progression of disease. These are RAS inhibitors, SGLT2 inhibitors, the GLP-1s that are kind of hot topics right now. Those have actually been shown, especially in diabetic patients, to slow progression of kidney disease as well. So there are interventions that we can take to slow progression.
Right. What you want to avoid is that, end stage where you need dialysis. And hopefully you can take steps to prevent and just be in touch with your doctor.
Absolutely.
Thank you so much, Dr. Beers. Wish we had even more time, but great information. Remember, for more resources and for all of our Women's Health Wednesday segments, go online, head to news10.com. Look for Women's Health under the Community tab.